Welcome back to Pharmacy Review, where we simplify pharmacy laws and regulations into plain, actionable information for professionals and learners alike. In today's session, we're tackling behind-the-counter drug regulations and drug administration, everything pharmacists need to know to navigate Utah law. Find out which drugs must be securely stored behind the counter. Explore limits on pseudoephedrine sales and dispensing requirements. Can legend drugs or syringes be sold without prescriptions? Learn which vaccines and medications pharmacists can administer and the conditions required. Whether you're a pharmacy owner, an aspiring professional, or prepping for your MPJ, this guide will keep you compliant and confident. Let's get started. Disclaimer: this channel provides educational content on pharmacy law, summarized by artificial intelligence. While efforts are made to ensure accuracy, information presented here may not be comprehensive or up to date with the latest legal developments. This content is for informational purposes only and does not constitute legal advice. Viewers should consult a licensed attorney or qualified professional for specific guidance related to pharmacy law and regulations. The creators of this channel are not liable for any actions taken based on the information provided. Always verify details with authoritative sources such as government regulations, professional organizations, or legal experts. Section 4. Behind the counter. Now, let's discuss behind-the-counter medications in the state of Utah. This is an important topic for pharmacy professionals as it covers the substances that require special storage, documentation, or limitations, but do not necessarily require a prescription. Let's break it down by category and regulation. Which drugs must be kept behind the counter? In Utah, any product that contains ephedrine, pseudoephedrine, or phenylpropanolamine must be stored out of reach of customers. These products are regulated due to their potential use in the illicit production of methamphetamine. According to Utah Code 58-37C-20.5, these drugs must be stored in a secure area not accessible to customers before purchase. This can include a locked cabinet that is viewable by customers but only accessible by employees of the pharmacy or retail distributor. So while these medications are not prescription only, they are subject to tight control. Dispensing requirements and limits. Pseudoephedrine products. Utah follows federal regulations under 21 CFR 1314 for the sale of pseudoephedrine and similar compounds. This means that a person may not purchase more than 3.6 grams of ephedrine, pseudoephedrine, or phenylpropanolamine in a single day, and no more than 9 grams in a 30-day period. These limits apply regardless of the number of transactions, meaning someone can't get around the rules by visiting multiple pharmacies. Additionally, all such sales must be logged and require photo identification and a signature from the purchaser. The log must be retained for 2 years and is subject to inspection. Dispensing of legend drugs without a prescription. Now, what about legend drugs, such as codeine or opium tinctures? Can these be dispensed without a prescription? In Utah, there is no specific state law addressing the non-prescription sale of certain legend drugs like small-dose codeine combinations. That said, in practice, pharmacies typically follow federal law, which classifies most of these drugs as Schedule 5 controlled substances and still requires some form of pharmacist oversight or prescription, depending on the exact formulation and federal scheduling. In short, the law is not explicitly defined at the state level, so pharmacies are advised to follow federal guidance and professional standards in this area. Syringe sales, prescription not required. What about syringes? According to Utah Code 58-37A-5, syringes may be sold without a prescription as long as they're sold in a sealed, sterile package. The use is for a legitimate medical purpose, such as injecting a prescribed medication, preventing the transmission of disease, like through needle exchange programs or harm reduction initiatives. This means that syringe sales are not criminalized and there is no logging requirement, as long as these criteria are met. Section 5. Drug administration. Now about drug and vaccine administration by pharmacists in the state of Utah. This topic is especially relevant as pharmacists continue to play a growing role in public health, preventative care, and emergency preparedness. Let's begin with one of the most common and widely authorized services, immunization. Can pharmacists administer vaccines? Yes, Utah pharmacists are authorized to administer a wide range of vaccines under a Vaccine Administration Protocol standing order. Let me list out the vaccines pharmacists are currently allowed to administer.
Influenza.
Hepatitis A and B, varicella chickenpox, measles, mumps, and rubella MMR, inactivated polio, meningococcal, herpes zoster shingles, human papillomavirus HPV, COVID-19 SARS-CoV-2, tetanus diphtheria and TAP, pneumococcal, Haemophilus influenza type B, respiratory syncytial virus RSV. All of these can be administered without an individual prescription, provided the pharmacist follows the standing protocol developed under state law. Immunization emergencies. What about adverse events? Although Utah law doesn't spell out detailed procedures, pharmacists are expected to be prepared for adverse reactions following immunization, such as anaphylaxis. The Vaccine Administration Protocol standing order typically outlines the proper response procedures, including immediate administration of epinephrine, emergency medical response activation, proper documentation and reporting of the incident. Being trained and ready for these situations is an essential part of being an immunizing pharmacist. Can pharmacists administer other medications? Yes, beyond vaccines, Utah pharmacists can also administer certain medications, including naloxone, an opioid overdose reversal agent, long-acting injectables such as medications used for mental health conditions or substance use disorder. However, there are strict conditions that must be met. The pharmacist must complete specific training as outlined by rules made in collaboration with the Utah Board of Pharmacy and the Physicians Licensing Board. Administration must occur in a clinic or community pharmacy setting as defined by administrative rule. The pharmacist must be acting under the direction of a prescribing physician, meaning there must be an associated prescription and physician directive to administer the drug. Is a collaborative practice agreement required?
Yes.
In cases where pharmacists are administering vaccines or other medications, there must be a standing order or collaborative protocol in place. This standing order acts as the legal authorization for the pharmacist to administer those therapies without an individual prescription each time. Facility and privacy requirements. Currently, there are no specific state-mandated facility requirements such as private rooms or partitions for immunization or drug administration. However, best practices and patient comfort generally support using a private or semi-private space to maintain confidentiality and reduce anxiety during procedures. Age limitations for administration? Interestingly, Utah law does not specify patient age minimums for pharmacists administering vaccines. However, standing orders often include age-based limitations. So, pharmacists should always refer to the most current version of the Vaccine Administration Protocol issued by the Utah Department of Health. Emergency use medications and legal protections. Let's talk about emergency medications, which pharmacists may dispense under a standing order without an individual prescription. Pharmacists and pharmacy interns are authorized to dispense the following emergency use medications.
Epinephrine autoinjectors, EpiPens.
May be dispensed to qualified individuals or qualified entities, such as schools or businesses, for emergency use. Can be dispensed without a traditional prescription under a standing order. Pharmacists must follow the dispensing guidelines outlined in Utah Code 58-17B-1004 and related sections. Stock albuterol. Similarly, stock albuterol can be dispensed to qualified users or facilities. Also allowed under a standing order, with no need for an individualized prescription. These authorizations exist under Utah's Emergency Response for Life-Threatening Conditions statutes. The intent is to enable quick access to life-saving medications in urgent situations like anaphylaxis or asthma attacks. Thanks for watching Pharmacy Review. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell to stay updated on all things pharmacy. Got questions or suggestions? Drop them in the comments below. Until next time, take care and keep thriving in your pharmacy journey.